Colorectal cancer is one of the most common gastrointestinal cancers associated with substantial morbidity and mortality. Advancement of endoscopic therapy requires a large animal CRC model. The oncopig cancer model is a genetically modified pig with inducible transgenes encoding for KRAS and TP53 driver mutations. The adenoviral vector activates the mutation, leading to cancer formation. Previous studies showed the successful creation of innovative translational cancer models, including hepatocellular carcinoma, sarcoma, and pancreatic cancer. Electroporation is a non-thermal ablative therapy. The major advantages are the high selectivity of the ablative effect. It is not susceptible to heat sink effect caused by surrounding vascular structures, and there is no associated thermal injury. Reversible electroporation occurs when an electrical field is applied to the target cell, creating transmembrane potential differences that result in transient micropores in the cell membrane. Increased cell membrane permeability allows passage of poorly absorbable substances such as chemotherapeutic agents or toxic cations such as calcium into cells. An early clinical study showed that reversible EP with bleomycin provided partial responses in 7 out of 9 patients and diminished tumor-related bleeding in 2 out of 3 patients. Recently, 2 clinical studies showed that reversible calcium EP was promising in treating CRC. The majority achieved symptom improvement during palliation of CRC. There were no serious procedure-related adverse events related to palliative and neoadjuvant therapy. Irreversible EP, IRE, also known as pulsed field ablation, can be generated by adjusting the electrical parameters, particularly increasing electrical voltage and treatment duration that prevents closure of micropores in cell membranes, leading to irreversible cell death, thus promising for use as monotherapy. Early experiences showed encouraging results of irreversible EP as monotherapy in pancreatic and prostate cancer. The device consists of a flexible O-ring to which the endoscope is attached, a therapy window, and electrodes on the lateral walls of the chamber. The pulse generator delivers a series of pulse bursts of biphasic waves with a frequency of 10 Hz and an electrical field intensity of 1 kV per centimeter. Our porcine CRC model was a genetically modified pig. Each animal underwent submucosal viral vector injection for tumor induction in the colorectum. The dwell time for tumor induction to IRE was 2 weeks. Histopathology showed pleomorphic malignant cells with a high nucleus to cytoplasm ratio and prominent nucleoli compatible with poorly differentiated carcinoma. 10 tumors were treated successfully with good or fair contact with the EP probe. The flexible O-ring of the electroporation device was easily attached to the distal end of the endoscope and secured with adhesive tape. The therapy window was oriented to the 6 o'clock position. The electroporation device is placed directly onto the tumor. A vacuum feature assists in drawing the tumor tissue into direct contact with the electrodes. The electrical pulse is delivered from the lateral walls of the chamber from side to side. The ablative area is non-thermal. The minimum ablation volume is 1.5 centimeters cubed. Here, the electroporation device was placed on the tumor. Negative pressure applied and energy delivered. Energy delivery can result in vibrations, as seen here. After each ablation, the chamber was irrigated with distilled water to control the rising temperature and prevent thermal injury. The probe was then repositioned to treat residual areas. There were no procedure-related adverse events. Repeat endoscopy was performed prior to necropsy and showed ulceration, 9 out of 10, and scarring, 1 out of 10, at treatment sites. Histopathology at varying time points showed tumor with superficial necrosis and superficial ulceration. Chronic inflammation with fibrosis was seen at 4 weeks. The histology image on the right shows necrosis post-irreversible electroporation treatment. In summary, irreversible electroporation technology appears to be a potentially safe and effective modality that may have a future role in CRC adjunct therapy and palliation.